There's skin cancer, there's cancers getting thrown at people left and right on the television, and this is one I haven't heard of. This is something I don't know anything about.
Well, multiple myeloma is probably, in the world, is probably 1% of the world's cancer, according to some of the research I've done and others. Actually, it mostly affects you when you get 40 and plus. It usually don't bother people under 40. It likes older people.
Women or men?
Both.
Okay.
But it happens to be more prevalent in African American males, more than any other race of people. Even with the black females, it's more in the men. It's cancer of the bone marrow, the marrow of the bone. To date, scientifically, there's no cure. It's an uncurable type of cancer. According to research, literally over 85% of people with multiple myeloma die within the first 29 to 62 months.
Everybody has plasma cells as part of their normal immune system. These are the cells that make antibodies. And myeloma cells also make antibodies, but unlike the rest of your normal immune cells, these aren't directed at anything. They're not generated to fight off something or to respond to something. These antibodies are just extra protein in the blood, and we refer to this as M protein, monoclonal protein or myeloma protein. Having an M protein in your blood, though, is not adequate to make a diagnosis of myeloma. Remember I said there's this other condition, MGUS, M-G-U-S, monoclonal gammopathy, that's the M protein, uncertain significance. Well, the uncertainty about what it means is that a few percent per year, 1%, 2% per year of patients with MGUS go on to develop myeloma, but the rest of them don't. And it's possible to risk stratify patients with MGUS, predict somebody who has a higher risk or a lower risk of going into myeloma. But the point is, it's really, in any circumstance, it's a minority of patients. There's a transition zone called smoldering myeloma, where somebody starts having more plasma cells, more protein, but they still don't have other symptoms. Smoldering myeloma almost invariably goes on to becoming symptomatic myeloma. But again, treatment can be held for a while until symptoms develop. I put a picture of a crab up here, but crabs is not part of the diagnosis of multiple myeloma. CRAB is an abbreviation. Calcium, renal, which is kidney, anemia, and bones. Those are sort of the cardinal symptoms of multiple myeloma.
Hi. Hello, I'm Dr. Melissa Runge-Morris on the multidisciplinary lymphoma team here at Karmanos Cancer Institute. I'm taking care of Ms. Ala, and I'm her cancer doctor. She's receiving chemotherapy, and we're doing the best we can for her. I do research in animal models and cellular models, trying to understand the cause of cancer and what to do about it once you get it.
Her chemo through IV caused her some problems, but overall the treatment itself, there's no hiccups in the treatment, but it's the after the treatment is complete that my sister becomes ill or has side effects. I don't know if I could find the correct adjective, but being there and seeing people really that you can tell that are nearing the end of their life is really just a very sad feeling. Your heart goes out to them and their families, as well as it just makes you sad for your own family because you too are experiencing the same challenges that they are. So it's not a good thing. It's really sad. Well, it's something that you pray and hope that families would not have to endure. Cancer is a disease that brings hardship to families overall. It's just a disease that impacts families in a way greater than people who have not had to experience it could ever begin to imagine. You would just embrace, but knowing that a cancer, a type of cancer, does not have a cure, again, you just do the best that you can and just hope that through research in the future there might be a cure for the disease, or worst case scenario that there are types of medication and or treatments that would help prolong your sibling's life. And it really puts everything in perspective. You know that the meaning of living each day to its fullest, that becomes paramount.
I would go with the Revlimid and dexamethasone with the anticoagulant regimen built in there, because those are that's a combination that you haven't seen before, and that works well in patients who have had their most mileage out of their previous treatment, and they're looking to get a different combination of medications in there. So I think that's what I would like to do next, and that's one of the options that Dr. Jakubowiak's team recommended too, so I felt pretty good about it.
Twist off and remove the plunger cap. Twist the needle cover counterclockwise and pull to remove it. Hold a syringe in your hand and put your thumb on top of the plunger. Be careful not to stick yourself with the needle. There is enough room between your fingers and thumb to put the needle in. Hold the syringe at a 90-degree angle to your skin. Then quickly push the needle into the fold of skin you are holding. Push down on the plunger with your thumb until you cannot push it in any further. Then lift your thumb. This is how you inject the medicine.
Cancer is what kills people more than the cancer itself. I truly believe that in the death of my mother as well as the death of my husband. I think that without treatment, I think they might have lived longer, because sometimes the treatment have these side effects where they lose the weight, they lose their hair, they lose their dignity. I don't think cancer is necessarily a pretty thing, but it can be treated with better respect than it is treated. And I think the medical profession, a lot of times, they're trying to improve everything, but while they're improving, they're killing people.
It's just something, whether it's environmental or it's genetic, that triggers it and affects whoever it ends up affecting. And everyone initially, the feeling is, how can we fix this, and how do we get rid of it, and what treatments can you give me? And I don't know that all cancers or all people want to treat it. There are people that just want to live the best life they can, and what's supposed to happen will happen, and take whatever treatments. Myself, I think the treatments are worse than the disease, and I wouldn't go through the treatments. I've watched 3 that I love very much, and the treatments pretty much killed them. So I just, I wouldn't, and I'm finding out that there are a lot more people that feel that way anymore. But I also don't hold it against someone who wants to. Cancer is a horrible, ugly, nasty disease that no one should have to go through. No one should have to go through. And all you can do is treat those that have it with as much love and care as you can. And it's going to do what it's going to do.